I'm Dr. George Kalyadan, psychologist practicing at We Care Medical Center at Ansar Gallery Building, Karama, Dubai. Today, I wanted to share with you some information about panic attack, how to identify panic attack, and how to treat it effectively without medication by psychotherapy, psychological treatment purely. As you know, probably you are aware, sometimes the panic attack is a kind of a mysterious kind of a disorder. In the sense it manifests itself, it is presented as something very severe, something, which appears to be serious, like, you have a severe, sometimes chest pain or breathlessness, palpitation or sweating, nausea, or you feel like heavy headache or kind of sensations in the different parts of the body. So different kinds of symptoms which mimic sometimes like it appears like it is something like a heart attack or a stroke. These are the kind of thoughts that come to people's mind. Therefore, many of them get admitted immediately into the emergency in the hospital because they don't know what it is. Well, it's understandable because when you have such symptoms, it is important that you seek professional help. So going to a physician or to a hospital to get oneself checked up is the right thing to do, yes. So, but now what happens? So once they are admitted, they go through a series of tests and investigations, and which finally they come up with the conclusion that there is nothing physically problematic. No physical pathology is identified. In other words, the heart seems to be clear and the lungs and the rest of everything seems to be functioning properly, but still the patient experiences the symptom, and the symptom might recur after some time, and therefore it becomes kind of a mysterious why without any physical pathology these symptoms still appear. And sometimes therefore the doctors just send the patients away saying that there's nothing wrong, you are okay. But the patient is not okay, because as long as the symptom persists, the mind is still preoccupied what is wrong with him, and the anxiety persists. So actually this is in such cases, in many cases, it is identified as an anxiety disorder. But very often the patients don't get the actual clear guidelines on what to do if it is an anxiety disorder. And it doesn't often occur to them to seek psychological advice or psychiatric help in such cases. So it is very important when you reach that stage when no physical pathology is identified, and you have to think in terms of psychological disorder called panic attack, which is caused mainly by an extreme level of anxiety. The thing is that the anxiety attack occurs suddenly without any particular cause, and it can happen anywhere, anytime. So one doesn't understand why and how this happens, and sometimes it affects, once this one episode happens, the people start thinking about it, or sometimes they are afraid that they might get another attack, especially if it happens while they are driving, or if they are they may. So it is important that the community has some awareness about this type of disorder, psychological disorder called panic attack, so that the right kind of help can be sought at the right time, instead of going through continuous investigations and without getting to know what is happening. It is important that we start seeking professional psychological help. So in fact, from my experience in the past 25 years or so, in this field, I can say that panic attack is treatable purely with psychological therapies. There are techniques and methods like cognitive behavior therapy, and in fact I use a combination of various psychological techniques to treat panic attack without medication. And within a few sessions, maybe 5 or 6 sessions, generally we find full relief from the symptoms. So it is done through psychotherapy, especially under the theory is that this anxiety can be due to some conditioning or a learned response, and we understand the person, the personality and the background and everything, and thereby we provide the kind of treatment by which he is able to manage this and therefore ultimately to prevent the attack from happening. So that kind of a full relief is possible. So it is good to know that treatment is available. Very often patients are not even there, they get confused and they feel very sad and depressed. Sometimes the people suffer for many years without getting proper assistance. That is why I wanted to educate the public and the people about this, so that if you know anybody who is having symptoms like this which are not treatable, which is likely to be due to the stress and anxiety, please try to take professional help, and we will be happy to help you deal with such situations. And as I mentioned to you before, we are here in Karama, Dubai, WeCare Medical Center, and you are welcome to seek professional help. Thank you so much.